The UK has more COVID-19 patients in hospital now than when Britain entered its national lockdown back in March. With hospital beds filling up, 3 overflow facilities are now on standby.
These figures are flashing at us like dashboard warnings in a passenger jet, and we must act now.
The North is leading the country in infections, but they are rising fast across the UK. England is now being divided into a 3-tier alert system. Under medium, groups are restricted to 6 people. Pubs and bars must close at 10. Most of England will be moving to the high level, which adds a ban on household indoor mixing. Under very high, pubs and bars are closed, and people are asked to limit their travel.
Areas within the very high alert category will be reviewed every 4 weeks.
Liverpool city centre will be the first to enter that very high alert level Wednesday. That means pubs and bars will have to shut down. The hospitality sector has said it is being unfairly targeted by the government. The Nighttime Industries Association is even considering legal action against the government. There are no plans at the moment to close schools, but universities have seen large outbreaks. Earlier this month, Northumbria University reported 770 infections. Manchester University had 127 cases in September. The majority of infections had been in the 16 to 29-year-old population, but older individuals are starting to fall ill.
The elderly suffer a much worse course with COVID-19. They are admitted to hospital for longer periods, and they are more difficult to save.
The Prime Minister says the months ahead will test the country, but he is confident it will succeed. Crystal Gamansing, Global News, London.
We really can't give the virus any chance. It will establish itself and spread widely, exponentially.
In the 2 regions with outbreaks, Moncton and Campbellton, some businesses are closed and there are additional rules to follow, including mandatory masks even in some outdoor public spaces.
This includes parks, playgrounds, markets, dog parks, etc., anywhere you may be sharing space with many others.
School children in the so-called orange zones have to wear masks most of the day, and extracurricular activities are suspended.
We've been privileged here in New Brunswick to have had some of our closest contacts with the disease for a long time being fear and a bit of anxiety when we see an out-of-province license plate. But now the disease is here in our province, inactive.
While the province says contact tracers have tracked down close contacts, there is concern from other provinces in the Atlantic bubble, with Prince Edward Island's Chief Public Health Officer discouraging non-essential travel to the affected areas.
Okay, joining me now is the New Brunswick Chief Medical Officer, Dr. Jennifer Russell, and I want to ask you about mandatory masking outdoors, because if we know that the disease isn't primarily spread there, why make masks mandatory there in these so-called orange zones?
This is an extra measure that we're taking in terms of precaution because we know that from a compliance perspective, one of our triggers to go backwards or forwards includes public health compliance with the public's compliance with public health measures. We did a survey. We found that there were many places around the province where people weren't adhering to the masking policies indoors, but we also saw a lot of people who were congregating in public settings outdoors.
Okay, additional measures, I understand. But again, if outdoors isn't the central arena, aren't you worried that people might see this as an overreach?
I hear exactly what you're saying, and obviously any public health measures that we take during an outbreak should reflect, should match the risk level. So we are very conscious and very aware that that is what we need to do in each phase, whether it's red, orange, or yellow. We are a very small province, and getting an outbreak under control quickly with the fewest number of people involved possible is critical for us to have success and not overwhelming our healthcare system. So this is why we're taking these extra measures.
One last question for you. If things continue on their current trajectory, is there any discussion about New Brunswick leaving the Atlantic bubble?
So I've been in constant contact with the Chief Medical Officers of Health in the other Atlantic provinces, and when the bubble was set up with the agreement of the premiers at the time, the understanding was that we would each continue to monitor the situation in the other provinces, and if there was something that from a risk management perspective and a risk assessment perspective that warranted any changes, that they would be done on that time based on the risks. At this point in time, we're confident that we've got our contact tracing done, the close contacts are isolating, and we have about 14 days ahead of us to monitor the situation.
Okay, we'll leave it there. Dr. Russell, thank you so much for joining us.
Thanks, Andrew.
With fresh coronavirus records set in France, certain cities or regions could be staring at another possible lockdown.
Contre la crise sanitaire.
The French Prime Minister warning local lockdowns could be imposed as the country faces a surge in case numbers that's putting increased pressure on hospitals. More than 40,000 new infections were reported over the weekend, a record. And authorities say hospitals have been caught in the virus's rising tide.
Et comme dans les
Says the Paris region's top health official, we're in a race against time.
courses contre la montre, on est
He says COVID-19 patients now occupy more than 42% of ICU beds in the capital and its suburbs.
Ça n'était pas arrivé depuis des décennies.
The Prime Minister offering a scolding to people who failed to heed health warnings. It's been a similar story in England as well. Hospitals in northern regions are at risk of being overwhelmed by ICU patients, some experiencing a 7-fold increase.
So, Mr. Speaker, we don't want to go back to another national lockdown.
Prime Minister Boris Johnson announcing a new 3-tier system of coronavirus restrictions.
And if we take a look at this article on Zero Hedge for Tuesday, October 13th, scroll down here. Netherlands, Ukraine tighten restrictions as countries across Europe see record COVID-19 cases. Live updates. Golfer Dustin Johnson tests positive. London Mayor Sadiq Khan supports circuit breaker. Let's go down and read some of this. London Mayor Sadiq Khan has joined a chorus of Labour officials calling for another 2-week circuit breaker where bars, restaurants, and other non-essential businesses would be closed. Mexico's government on Tuesday signed deals with AstraZeneca, Pfizer, and China's Casino Bio. Sufficient vaccines to inoculate 116 million people by the end of next year. Finance minister said the government has... Ukraine's government has closed schools and universities again, with the closures set to start on October 15th. The Dutch government is returning to partial lockdown on Wednesday. The sale of alcohol in the evening will be barred. Restaurants and bars will be closed. And visitors to another home to three restaurants and bars and visitors to another home to 3 and stop amateur sports for adults. Earlier, Cristiano Ronaldo tested positive for the virus, although he is asymptomatic. United Arab Emirates report its highly daily COVID-19 infection tally. Poland's Prime Minister Mateusz Morawiecki entered quarantine. This is interesting, but perhaps the biggest news on the COVID-19 front for overnight was Johnson & Johnson's decision to pause its 60,000 patient COVID-19 vaccine trial. Anyway, that's a quick update. Thanks for watching the video.